Introduce my committee members, which we have from University Hospitals of Cleveland, St. John's Medical Center's president, Robert David. Thank you, Rob, for being here.
Thank you for having me.
Absolutely. And then we also have joining us virtually Lou Fabrizio, which is, he is a music business professor here at Berkeley, and he's joining us too virtually, so thank you, Lou.
Thank you. My pleasure to be here.
And then, of course, my third committee member, last but not least, Dr. Suzanne Hanser. Thank you. All right, well, we'll get started here. Medical Music Therapy Business Plan, a patient and staff-based program model. So, once upon a time, a younger Seneca was going to a chemotherapy treatment with his mother. So we arrived to a room of patients waiting to be seen, and when I looked around the room, I just saw defeat on all the faces of the people there. And so we sat down, we found our way to our seats, we sat down, and in the corner of my eye, I saw a grand piano. And me being me, walked over, and I sat down at it, and I started playing a little bit. I played a little melody with my right hand, added some chords with my left hand, and before I know it, I kind of started playing a little song. I'm not a pianist, but I just made something up. And as I lost myself in the music, I looked up for a second and I saw that all the faces that seemed to have this defeat and this despair, it had vanished. People were looking up in the room, they were moving with the music, they were smiling. And at that point, the nurse actually thanked me for playing, and I didn't know what I had done, except it was my light bulb moment of seeing something that was something that I would like to do as a career. Now, I reflect on this story quite a bit because it was my first experience with using music therapeutically. And in that moment, I look back at that moment many times and think about the fact that we need to connect the dots and take this wonderful thing that's happening and connect the dot to explain that wonderful thing to the decision makers. So to administration, to the people who are going to actually fund this thing and get these patients and people who so desperately need this music to get it to them. So after I thought very long and hard about connecting the dots, and I'll talk more about how this sort of grew organically. What I also saw was the fact that the MT field needs business education. And this is something that's come up all week, so nothing new. But we're going to be looking, my thesis is going to be used to, one, outline a business plan, and two, it's going to be used as a manual that actually has italicized sections which give a lesson to the music therapist reading it. So again, in connecting these dots and bringing me back to my actual thesis, where it all is going. This is in the form of a business plan that articulates program models, that articulates goals, outcomes, metrics reporting, and actually gives timelines for implementation, which is very important to just give an overview to administration. So a little bit about myself. I'm a lifelong musician, sound engineer, board certified in music therapy. Had my undergrad here, back for round 2, they couldn't keep me out. And I have a background of completing rotations through several hospitals here in Boston, McLean Psychiatric Hospital, Tufts Floating Pediatric, Horizons for Homeless Children's nonprofit organization, and the University Hospitals of Cleveland, Simon Cancer Center. So my personal experience that brought me to this master's thesis really was the fact that I received a position. Bless you, that is the cutest thing I've ever heard. Baby sneeze. When I began my position on Conner Integrative Health Network, which is a branch within University Hospitals of Cleveland, I was the only music therapist on board. So I was very lucky in the fact that I got to work from a ground-up approach, and really I had a blank canvas. And that's actually something Rob David would say to me quite often as one of my mentors there, was that I had a blank canvas to paint on and to make this anything that I wanted. So after beginning with Conner Integrative Health Network, I got the chance to really focus on learning what it was that we need to communicate and what we need to share with administration. And again, that was thanks to my mentors that were helping me do this. And what was also really nice is with this culminating experience in this project, I was taking information directly from this master's program. I was getting to actually drop the arcuate fasciculus bomb on physicians, and really getting to speak clinically and share my education. So really working with Connor Integrative Health Network with a focus on wellness. And one of my favorite things about doing this, and the things that I felt so fortunate about, was that I was getting to learn from mentors in other fields. And I think that really was one of the keys to my success there, is really getting to hear what other people have to say and how they've done things outside of our own field. So with that said, I'm going to get to the whole plan and get to the different sections. But to preface it, this has been a really long process, and it's a process that's continuing to evolve and grow. By no means I'm not stopping here at all. But the couple lessons that I learned throughout this process really was to ask questions. Really important. So much terminology is thrown around in business, and it's also many times it's in the culture that you're working with. There's different work cultures, different business cultures, depending on what organization you're working with. So that's very important too. And also, again, looking for mentorship was one of my biggest lessons I've learned through this, because so many people know more than I do, and you need to go find those people and talk to them, be their friends. Reading and honing new skills. Within my thesis, I also included an annotated bibliography, which is actually taking some business literature, music therapy literature, and different books that highlight strategic thinking. I actually have a summary of these things and things that I recommend having a read. And then probably my favorite lesson learned was fail and fail again, never give up. Throughout this, I've rewritten it so many times. And it's funny, I was having a conversation with a colleague back from Cleveland, and he said, how is all this stuff working out for you? How's it working? You're doing all this stuff. And I thought to myself, I fail all the time. But the thing is, I try 10 times harder, so my success rate's actually the same. I'm just doing way more. So you try something once and you fail, you try it 10 times, you'll get one success. So never ever give up. Great, so again, the business plan, bring it back to the business plan. The idea of this is really providing an outline of programming and logistics, clearly stating the vision, aim, and vision, providing concrete timelines. This is really important, having a plan from day one. What's most important I've seen is that everyone within a hospital system is already stressed out to the max. So if we come in as music therapists and want to have a job title or have a job that we add on to someone else's plate that's already really full, that's not going to fly. So we need to work really hard to make this as easy as we can for the administration. So providing that concrete timelines and having a plan from day one. That's also important so that we're not wasting resources. So we don't have times that are not being utilized for something, because that's a waste of money. And highlighting metrics collections and sample assessments. So the first section of my business plan proposal, and again, I'm providing this, and if you would like to look at my thesis, I'll have little annotations that sort of give and highlight the reason for each section. But this is hard to see, and I don't mean for you to read it right now, but this is an example of section A, which is a tactical breakdown. Now, a tactical breakdown is extremely important, because when you're in a meeting, or when you're even passing with someone, or you're just sending someone an email, the first thing they see needs to be a clear outline of what the program would be, so that they could just pull points from it and you can talk from it. So this tactical breakdown encompasses the several sections, including the MT Music Therapy Program Model Focus and Overview, which has 3 sections: patient experience, employee engagement, and environment of healing. Those have been the 3 that I think are most important to hospital systems that I'd recommend focusing on. Section B talks about metric collection processes, and Section C is a program model objectives, followed by an implementation timeline. Again, so important to give a concrete way to show how this program will be implemented. And D, extremely important, expense and financial breakdown, really showing when you give that number, for example, I gave the $75,000 annually, you have to show that salary, benefits, training, program oversight for our program per FTE, and then you're also making sure you highlight that there are equipment fees within that too. So having these numbers to bring and actually present in the moment. She agrees. So if there's one thing that I would really love to share with everybody here, and there's one concrete point you take away, that's a really crucial understanding point about HCAPS. By show of hands, who's familiar with HCAPS? So for us not. HCAPS stands for Hospital Consumer Assessment of Healthcare Providers and Systems. This was the first nationally introduced means of both measuring and publicly reporting hospital facility quality standards in the United States of America. And the thing to understand about HCAPS is hospitals are ranked nationally, and then depending on their rank, they're given a percentile. And depending on their percentile, they get a percentage of reimbursement through Medicare and Medicaid. So the crucial point here, the takeaway, is that music therapists have an impact on patient experience, have an impact on the employee engagement, have an impact on these sections that pertain to HCAPS. So if we have an effect on that, that is translated in surveys, which is translated to our percentile rank, which is translated to increased profit. So that is a crucial point. The different areas of the HCAPS, overall rating of hospital, recommendation of hospital, communication with nurses, communication with physicians, hospital environment, transition of care, communication about medications, discharge planning, and responsiveness of staff are all the section of HCAPS. And this is a survey patients receive about 2 weeks after they're discharged. Now, implementation of this first section, the focus is on pain management and stress management. Now, when it comes to inpatient populations, these are the two that I would recommend focusing on. There are many more that we could. And also, it's of note to remember that your geographical location may dictate how you design your programming. This is just a framework for you. However, in Cleveland, Ohio, pain management and stress management are the two biggest. Under pain management, we have an opioid crisis going on right now, particularly in Cleveland, Ohio, with heroin. So it's to the point where Joint Commission, which is an accreditation union, has actually removed the pain rating from the HCAP survey because they thought it was pressuring doctors into overprescribing opiates and aiding to the pain crisis, or the opiate crisis. Now, what's really interesting and really exciting is that we developed a pain team within my hospital where it's interdisciplinary team rounding with myself and a pharmacist, where we actually address the mind and body needs of patients, where the pharmacist is actually adapting their medications, and I'm talking about non-pharmacological means of pain management. Now, what's really exciting to me is that this team was scoffed at a little bit when they removed the pain management section. And we said, oh, well, I guess we won't have a pain team. However, it was removed from that to be placed into Joint Commission accreditation processes, which will be dropping this next January. So now, hospitals will be required to provide or promote, they're still working on the verbiage, non-pharmacological pain management services, and they dropped music therapy as a particular one to provide. So that's a really exciting point, and I just nerded out and was emailing the director of Joint Commission, and she replied, so we have that date is set for January 1st, 2018. Next is stress management. So we know that stress is the leading cause of and exacerbator of so many illnesses, and having this holistic integrative health model, and on top of that, what's really important is these services that promote stress management or we use for stress management, I believe these have an impact on the overall experience of a patient, not only in taking care of themselves, but one thing that I've really noticed as of late is there's consumerism and shopping around within patients. So they don't have to go to this hospital, they don't have to go to this hospital. However, when you look at the 10 top-ranked hospitals in the nation, everyone has a music therapy program. Great. So the next next focus point for this section is employee engagement. This is the second main point I think that's so important for one, promoting well-being for the staff, and another really important point, and this is something Rob David always helped me understand, is that patients actually have so many contact points. And I mean that by their interacting with the nursing staff, the physician, the housekeeping, the respiratory therapist. If they're having all these interactions that are negative, it's going to affect their well-being while they're in the hospital. So if we can take care of the caregivers as well and help manage their stress, it's going to translate back into the patients. And again, reducing burnout, which we have studies that show that recreational music making can actually reduce burnout and has an annualized cost savings amount, which is also pretty amazing. So implementation of this would be staff wellness, caring for the caregiver, employee in-services and education, staff stress management, group music therapy events, including drum circles, instrument learning workshops to promote positive coping strategies. One of my favorite things about this is we introduced a ukulele class, and they made the sign, it was Ukulele with Seneca. I didn't choose the title, but they made a big sign for it and everything at the hospital, and we actually had several nurses and even a chief medical officer or chief medical staff member who ended up retiring. They all took my ukulele class, but this particular gentleman, and Rob, this is Dr. Martin, actually took the ukulele so far when he moved, he's written a book on ukulele, and he teaches it in his Florida community now. And he just found me on Facebook a few weeks ago and thanked me for doing that. I had no idea the spark that was, what it kindled later on. It was an amazing thing. But again, it introduced something brand new for him, especially into his retirement. And I have several nurses that have done the same. They've actually found their own ukulele circles that they've invited me to now in Cleveland, which is really neat. So again, it's just the idea is that you're going home and you're hitting the ukulele instead of the bottle, right? So this is promoting positive coping strategies, and again, that's fighting burnout. The last section is the environment of healing. So historically, this is one of the lowest rated HCAP scores nationally. And it's also one of the most difficult because it's very hard to control noise in a hospital. You have long hallways, the sound bounces, and also you have staff members who are coming into work during the evening, and that is their daytime. So they don't often, I've noticed people don't compartmentalize it that way. They don't think it's night anymore, they think it's day, so they're using daytime voices. They're walking through the hallway, they're laughing together. And what's important about that is the HCAP survey actually asked, how quiet was it around your room at night? Were you able to sleep? So what I see is that music therapists have a specialty in producing sound, recording, and isolating sound. If there's anyone else in the hospital who has a shot at making this better, it's going to be the music therapist. So it's really about working on transferring your skill set. So a couple things that I've developed, and I've included these sample documents in my thesis as well if anyone's interested, are one, a noise audit, locating, assessing, and mitigating noise sources, awareness and education. I actually get to present to all newly onboarded staff members at my regional hospitals, and I do an education. One, just sharing what is sound, how does sound physically work, how do sounds add on top of each other and exacerbate the issue of noise within the hospital, and what can they do to actually change it and make their workplace better. So, and then lastly, just using technology like noise canceling headphones, earplugs, things that really help the patient perception with environmental noise and create a healing environment. So the next larger section goes on to metric collection process. So metric collections serve as a means of presenting programming, track program efficacy through outreach in terms of number of individuals served, This is very important to have this concretely defined as a means of data collection for administration, and it's also needed for monitoring the program to make sure that things are being effectively run and to justify continuance of program funding. Now I get to section C here, that's a program model, objectives, and implementation timeline. This is probably the most crucial part, and this is something I can very much so thank Lou on helping me design this and implement this into my thesis. Introduce a set of objectives with implementation timeline to clearly illustrate timeframes. So I broke this down, for example, down to quarters. So for example, quarter 1, employee presentations and services, program visibility, and promote staff self-care. And then this is a breakdown so that you can actually you can see it from hopefully where you're sitting, and you might not be able to. This is what it would look like actually being presented. You're going to have that broken down to different quarters and with the objectives within each quarter. So then, section D, extremely important, expense and financial breakdown. The cost of developing the program. Now this may vary by state, depending on where you are. It could be more, it could be less. Price point when entering a business meeting is extremely important, and it's required for administrators' consideration for funding. And there's nothing worse than not having a number and someone saying, "Oh, we might be able to do this," and then you drop a number that they had no idea was coming. So it's really good just to be upfront about everything. So what's really exciting about this project and this process is that all of these materials have had in-field use. I presented these at board meetings. I presented these to administrators. They have been successfully implemented. So when I began with Conner Integrative Health Network, I was working a 20-hour position. After proposing increase in my position to Rob David, I became a full-time employee, and during the course of this master's program, I've used this information directly, and we've developed a total, with myself included, 4 full-time positions, created and sustained, and I just used this thesis project to submit for a 5th position, which will be coming on closer to the end of the month. So I'm continuing to develop metric collections, and again, this model is continuing to develop. So this isn't the end-all be-all, but it is a place to start with. So again, I just explained this, but we have our full-time employees at Richmond Medical Center, Bedford Medical Center, Ahuja Medical Center, Elyria Medical Center, and soon-to-be Geauga and Portage Medical Centers. Now that was a mouthful. So at the end, the major lessons I've learned from this process: there is a dire need for music therapy in the medical setting, but we must communicate effectively, and what's so important is not being afraid to step outside of the box. So often I think we don't think to do something because no one's done it before. Not for this group of people, because everyone here is a rock star. But it's really important to step outside of the box, and that's again something that Rob, something Susan, something everyone I've worked with has really pushed me for. Another big one is not assuming that everyone is against you or everyone's not going to approve you. We have that idea in our head where we walk into a boardroom and you think that it's the big, scary, tall back chairs, and you realize everyone's a person, and if you give people the right opportunity, I've found that people actually really want to help you. Most people like music. It's a thing. So lastly, I have to go into my acknowledgement phase, and I would first like to thank the hottest roadie in Cleveland, my wife, Sarah. She literally is an angel walking by my side, and she's gotten me through so much, and I could not have done any of this without her. I'd like to thank my family. Without them, I wouldn't be able to do this either. Oh, bless there. I'd like to thank my committee members, Dr. Suzanne Hanser. You've meant so much to me during this process. Rob David, you've been such a great mentor. Luke Fabrizio, thank you for your business. My professors, Kathleen Howland, Karen Wax, thank you. My cohort, all such rock stars. My dog, Warwick. He's my best friend. And Dory's my second best friend. And she's a cat. I'd like to thank some really important mentors, Dr. Richard Holsworth and Dr. Francois Zidane, my medical director, not pictured. They've been so instrumental in pushing me to do this and supporting me. And then more people from my, more mentors, Wayne Aiken, Bob Garkowski, and my colleagues. My band for keeping me sane during everything. It's so important. My bass. Mary. And lastly, I have to thank music for making all this possible. And to end, I have a song to share.
Of course.
So one last story here. So I've been a music therapist for a few years, and one of the first songs that I wrote with patients, we talked about, it was called Lose to Win. It's the title of the song. And we talked about how sometimes it's scary to step outside the box and move on from something. But how when you do that, there's something so beautiful waiting on the other side, and you really have to lose something to win something. And this is a song that I've kind of carried with me, and I'd just like to share as a gift to you all right now. Sometimes you have to lose to win. Tear down the walls and rebuild again. Burn every bridge like your feet are on fire. Laugh to yourself as the flames grow higher. Don't be afraid to make your stand. Sometimes you have to lose. See, life's got a funny way of working out right, and it's always darkest before the light. So keep your chin up and your demons down, till the shadows lift from your worried brow. And don't be afraid to make a stand, 'cause sometimes you have to lose to win. Every footstep that you ever left. Walk through the valley in the shadow of death, with your heart broken heart inside of your chest. Don't be afraid to make a stand, 'cause sometimes you have to lose.
Thank you, Seneca. That was quite remarkable, and it's been incredible to witness the success that you've had, and it means a great deal that you credit your learning in this program and the development of this thesis with some of that success. I think you can also take a good bit of credit yourself for obviously your talent and creativity and your confidence to pull all of this together. So
Thank you.
congratulations to you.
Thank you.
And I'd like to ask Lou, first of all, thank you for joining us today and also for assisting with the business plan, which really created the format for this thesis. Lou, do you have any questions for Seneca or comments?
First of all, I'd just like to say it's been a pleasure to do this, and I've appreciated it very much. When I teach my principally in my business management courses, they all develop a business plan because it covers all aspects of business from start to finish, and whether or not you're starting a business and you're going to be an entrepreneur, or you choose to work in a company, it's every element of a business that you need to know. So this has been, I want to congratulate Seneca because I think he's done a superb job. This is very, very comprehensive. It's a subject I knew a little bit about, music therapy, not a lot, but I've learned quite a bit just going through this experience. So I just want to applaud him for the work he's done on this. It is very comprehensive, it is very detailed, outlines a very, very good roadmap, and it's the kind of work that, you know, I would see from my top tier students, no question about it. So I just want to make that comment.
Thank you.
Well, that's a high compliment coming from you, who've worked with so many business students, so thank you, Lou.
Oh, my pleasure.
Do you have any other questions for Seneca?
No, I don't. I mean, I think that, you know, we've gone through this. We did a little back and forth, and there were some comments that I made, suggested that he's incorporated in here, and I you know, I think it's. I'm very pleased with the work here, and I think it's just very well done.
Thank you again. Wonderful. So I'll turn to Rob David, and first of all, thank you for being such a wonderful mentor to Seneca, and obviously your leadership has been instrumental, if you pardon the expression, in creating these positions and in fostering Seneca's career, so thank you. What questions or comments do you have for Seneca?
So I really probably don't have any questions, but the one that needs to take credit for this is Seneca. I may have helped him a little bit and to think about some things other than music, but he's the one that deserves the credit. I'm so proud of what he's been able to accomplish. When the first time that I met him, I kind of, I'll give you a real quick story, and he knows exactly what this story is going to be all about. So the first time I met him, he was kind of strumming a little bit in administration, and one of his other colleagues, Wayne, is a Jamaican gentleman who's in a reggae band, and Wayne was our director of operations. So, make a long story short, they start find out that they both are inclined to music. So they go up to a patient's room and they start to talk to this patient, and this patient says, you know, I don't really feel good. I don't want music therapy. And, you know, Seneca, the way that he is, very persistent and a great advocate for patient care, secured this woman to make her understand that music therapy was going to help her. And all of a sudden, she has this real defensive look on her face, and by the end of the music time, she's dancing around in her bed, so much so that it caused an alarm to go off. The patient was fine. Everything was great. But it just shows that you could take someone that was not feeling the best and totally take their mind off of the pain and anguish that they're going through and make their life better. And then I would tell Seneca that our employees go through such a lot every day, the nurses, et cetera, et cetera. So I challenged him. I said, Seneca, not only are you doing this for the patients, but you should think about how to do this for our employees. So our employees, and we've heard about compassion fatigue. Compassion fatigue is really related to people in the healthcare industry, about the turmoil, the bad news, things like that we all go through on a daily basis with respect to reimbursements, you name it. So I kind of challenge Seneca to kick it up a notch, and let's try to permeate through our employees and make their day better. And if we can make their day better, they're going to make our patients' days better. So he was instrumental in doing that. And then finally, the most important thing that I'm going to leave you with is something that's touched me to this day, and I tell this to every one of the people. So we had a very significant population of elderly people in the community. Many of them were shut-ins, many of them didn't have family around, etc. So Seneca creates this program called Songwriting with Seneca for these elderly folks. And for an hour, he pulls them in, and they come up with a topic. They sit around in a circle. They come up with a topic, and they write the song. And at the end of the song, end of the time that they write the song, they sing this song. And he burns a CD for each of them. I probably haven't told him this, but I was just wondering how many of these folks have CD players, but it's a good idea that he burned them for them anyways. Nonetheless, it made these people feel like they accomplished something. It brought them out of their elements. So Seneca has done so much more for music therapy than just for our patients. I got him to think outside in how to bring music therapy to a number of different peoples, a number of different venues, a number of different mediums, so that music therapy can benefit, instead of one-on-one with a patient, that it can benefit all of our employees. And many of our employees said that this was the best 15 minutes of their life or their day when Seneca, they would go to ukulele lessons or what have you. So I know that I've spoken too much, but I think so much of what he's been able to accomplish, his leadership skills. So I just felt that this was fitting that I gave him kind of the way that I've felt through this whole thing.
Well, Rob, thank you for those incredible words, not only because we're all very proud of Seneca here, but because there's a room full of our degree candidates who are about to receive their degrees tomorrow. And I think that your words are so inspiring to them and empowering. So how do we get more hospital presidents like you? Obviously,
I think that we really need to publish some type of white paper, something that shows that music therapy is not specifically related to one group of people, that music therapy can be as instrumental in employee engagement, which is the most important thing. So I tell people all the time, I don't so much care about quality, I don't so much care about patient satisfaction, I don't so much care about financial performance. If I don't have engaged employees, I will never have great quality, I'll never have great patient satisfaction, I'll never have great financial performance. So if he's able to make our employees' days better, just think about how they're going to take that to the patient.
very important point. Thank you for that reminder. Do you have any other comments or questions, gentlemen? Then I'll turn it over to our group here.
I'm good, thank you.
All right. What do you think?
Wow.
I'm curious to know if you think that this business plan will serve you, and if so, how you might use it. Please ask any questions so that you understand more about what Seneca is providing through this culminating project. And also know that we hope to publish this in something called the Case Center, where you and others would have access not only to the report itself, but also PowerPoint presentations, perhaps audio files, I don't know, yeah. So other materials that could be available for you on this side.
I just want to say, wonderful job, Seneca, and so many good reminders in there for me, and I mean, a few things that were maybe new, but other things that just I don't always think about. Like with my study, I was so narrow and zeroing in on one procedure, but
Yes.
what you said about HCAPS is like something I want to immediately be thinking a lot about.
Mm-hmm.
It's not something that I've been talking much about at our hospital, but I know that it's a factor. And the way you presented it was so clear. Your whole entire plan is just so comprehensive, and I think it could help all of us.
And that's, thank you. And that's something too, you know, working in the hospital and, you know, HCAP sometimes can almost be like a dirty word, and there's, you know, jokes about it or this and that. However, HCAPS is a measurement of how well we're treating these patients. And we have to have something, and if we treat them better, they'll be better. So that's why they're so important. It's not necessarily the HCAP, but it isn't a measurement of how you're treating these patients. It just happens to be that if you treat them really well, you make more money. So that's a good thing, so everybody wins. But, you know, again, that is, you know, I think that's something, that's a big takeaway that I took from this project, and just realizing that vision of really the patient care. But like Rob said, and I was so lucky to have that advice, figuring out how you can influence patient care by stepping it back a little bit.
So many things. You did.
Speak up so
Okay.
they can hear.
It's amazing. I think to start, just the fact that it exists at all is helpful. The fact that you can go, you know, when people aren't familiar, in the area I'm in where there aren't any music therapists in the medical facility, they don't think outside of their area. And so the fact that it exists is like, oh wait, it actually is a thing. We're not the first hospital, so that component, but all of the details inside, I liked, like we talked about HCAPS and patient satisfaction, but you went so much deeper and more creative, so when you go in and they're like, we don't really care about patient satisfaction, and I'm like, oh crap, that was my point. You have so many more ways that you integrated in, like the pain and the opioid and everything. I really like the model and how it's structured and all of the different options, so you can kind of pull from in those instances and be like, that's fine, how about this and this and this. It was just, the presentation is really great.
Please.
I really appreciate that you're giving us a tool to go forward with, because as music therapists, we're always asked to reinvent the wheel. You know, you started a new place and you're probably, most likely, the only music therapist there, and they want you to build a program, or, you know, so even just for that, not even just to, you know, say, can we start a program, but when you start at a place, like, this is a great foundation for music therapists, but then it's also this awesome tool for hospitals too. It's really cool. It has so many uses.
You know, I don't think you mentioned that this project includes an annotated bibliography, so that there are sources that you can cite, findings that you can repeat, so that you don't have to do all the work Seneca did for you.
Thank you.
So I won't have you reading 6 books, just 6 paragraphs, and getting the gist.
Yeah, books on business as well as meta-analyses of music therapy and such. Erin, did you
Karen?
have?
Karen? Oh, Erin? One of the ins?
You are creating a model that all of us can follow, and I think that that's something that's so powerful. But also your presence, you have an incredible sense of relaxed confidence that you're just believable. I mean, you have that face. I mean, who wouldn't trust you? You know, you really have a sense of and I think that what's important, and what I was hearing is, again, and I've heard this in other presentations, but what value do you bring, so that you're not talking about how it's great for specifically the patients, but the whole comprehensive value. So if you even use the word value and consider it as you're building your programs, I think that would be great. I think you should come back to Berkeley and teach a music therapy business course. I think that would be wonderful. And also the idea of noise control, because I think we as music therapists also need to look at what we're doing that's unique, that isn't being done by other disciplines. So you need to really focus also on, this is something new, it's different, it's effective.
I'm sorry.
Karen,
All right, you go next.
Thank you.
Don't forget the end.
Oh, I just wanted to, I just wanted to say that I'm really looking forward to being able to read all of the additional details and notes of your whole project, because you have mentioned so many things that I had considered and thought about, but like, you know, it was like things like the noise control component is a huge issue in my hospital, and it's like something that's always on the back burner for me, but it's like, just getting down to the nitty gritty and like figuring out like what is step one. And so I'm just really looking forward to seeing like your thoughts on that and you know, all those components. So thank
Absolutely, you're welcome. And that's in that the actual thesis there are defined points, and yeah, you'll have at least 3 kind of concrete things to pull from and try. Yeah, thank you.
Brent?
I want to apologize to Erin. I just got very excited because what Karen said made me. I think she's absolutely right that this should be a course, and maybe undergrad, maybe part of the master's program. But I know Seneca is probably not going to leave Ohio, so maybe it's an online course. I think it's extremely important, and it's something that we're all learning, and I can see all of us are going to be applying these ideas. And I was just saying to Erin, I'm like, how can we have access to this right away? What did Suzanne say? How can they were going to send it to us? Like, it just seems very relevant, and I just feel like no matter what setting anyone is in, they could apply these same concepts. And so, yeah, just
Make me bashful,
excited.
right?
I think
Excited for us.
Yes.
this is such like a wonderful and fabulous way to end the theses, like the defenses, because I think this encapsulates everything that we've been talking about and everyone's touched upon all week. I know it directly relates to the work that I've been doing with, you know, the idea of referrals and establishing programs that fall in line with standardized practice that's you know, really, that's beyond typical music therapy. This is next level music therapy, and providing the research-based music therapy that we all know and we all love and we all practice, that needs to become standardized. And you've offered a tool for us to be able to do that. And this is just, I feel like this is just really going to take the field in such a positive direction that's more business mindful of how we interact with our fellow colleagues on the administrative level. So kudos, because this is amazing.
Thank you.
Yeah, I just want to say, obviously, great job, you're awesome. But I think also, you know, it's a testament to the support of your facility, because I think sometimes you don't know who to go to and how high up of a meeting can you really have with someone who can make a change. And I feel like, you know, you're so lucky too that you're able to have these strong connections with your leaders at the hospital who can implement these changes and okay them, and you know, and we're open to them and seeing the change and jumping on board. And I think that says a lot about your mentors, and it's just fabulous. And I think they're part of that model that makes it work.
Absolutely, and thank you so much. And I'll add to that. You're absolutely correct that my mentors helped me do this, and they allowed me to do these things. Rob David, but one I didn't mention as much is really my medical director, Dr. Francoise Adon. She is a medical director with an absolute heart of gold, who's believed in me the entire time, constantly supports me, sometimes more than I want, and always pushing me to try these things, but in a loving, really caring way. And I'm so proud to be on that integrative health network with her, and then also having the colleagues like Rob David and my other mentor that I probably should talk more about again is Wayne Aiken. He's the director of operations. He's also in a reggae band. Has been such a great leader for me and a mentor. At the end of a hard day, he has an office right next to mine, and I'm able to go over and just either cry on his shoulder or tell him, he'll see my eyes everyone knows when I get really excited. I get a crazy eye look. I go in there and I go, Wayne, listen, you won't believe what happened. but having him there to help guide me and help have me consider using music and using music in different ways and in the community too. He's also been a big person in that regard.
Well, I certainly agree that, oh, sorry, was there more? Please, Nicole.
I actually had a question.
Yes.
I was wondering, as you were like getting excited and I was remembering everybody else's and kind of how we thought about and talked about future directions.
Mm-hmm.
I was wondering where you were with that, like what you were hoping to do and where you're,
So I think this is really just the beginning of developing techniques to help the field, and also continuing to develop programming within my hospital system. I'm really fortunate to be in one of the two largest hospital systems in northeastern Ohio, and we have I've been meeting with my executive director and my medical director, and we have several more these last couple months. And I was laughing because it's funny, it's almost like when it rains it pours. As I was preparing my thesis, I was also presenting at several executive board meetings, music therapy programs, and it's looking very positive. And so 2018, I hope, holds several more full-time MT positions. And really the idea is to continue to expand, and my dream is to have a music therapist in every hospital. It's needed, and not necessarily in the far future, not necessarily one per hospital. I would love to see the field be to the point where there's a physical therapist on the floor, there's a music therapist on the floor, there's music therapists clocking in. It's a normal part of your work day. It's going to take a while for us to get there, but that's the future that I really want to see.
Well, with you leading the way, I think it could happen in your lifetime, if not mine.
Do my best.
But indeed, with your mentorship, Lou and Rob, I hope that we can continue this vision of Seneca's and of our profession, and I think we all want to create better care for people everywhere, and so let's continue this remarkable collaboration and make it all happen. Thank you. Final words? Did I hear something from you, Lou or Rob?
No. I concurred with what you said. I thought that very, very succinctly put.
All right.
I completely agree.
Thank you again so much, and congratulations, Seneca.